Okay, good afternoon. I guess we have the honor of closing out the day's sessions. So I hope that the sugar from your dried bananas and chocolate chips kicks in right now. So I'm Kristen Rapp. I'm the Executive Director of the Free Clinic Association of Pennsylvania. I've spent the last year figuring out how many free clinics there are in Pennsylvania, and I can tell you with surety that there are 52 right now. And of those 52, 20 do provide some kind of dental service, though that ranges from the Mission of Mercy one-day clinics with cleaning and extractions to a few that are like walk-in, up to some of the folks that are in the room today from Community Volunteers in Medicine in Chester County and Volunteers in Medicine in Wilkes-Barre and some of our other locations where we have a full range of dental care provided, including restorative care and assistance with people getting dentures. So the whole gamut. And I'm going to ask the panel to take a few minutes to introduce each of themselves as well. Let's just start with you because you're closest to me. Can you tell us about the clinic that you're at?
Sure. My name is Calvin Hoops. I'm the dental practice administrator at Esperanza Health Center, which is an FQHC located in North Philly. And did you want us to share or just that? Or?
You want me to go to the next part? If there's more that's interesting.
So I've been there, I think around 16 years. Started as a dental assistant. And then, I've progressed through there. So.
And who do you serve?
So we serve, basically our mission is actually to the Latino and underserved communities of North Philadelphia. We're at Kensington and Allegheny, if you're familiar with that. That is sort of ground zero of the opioid epidemic right now, in our community. So we see it every day there. Even just this week, there's tents right out on our front steps every morning and every night, after patients leave. The struggle there. But otherwise, been working in the dental clinic my time there.
Great, thanks. Darcie?
Hi, my name is Darcie Schaffer. I am the manager at Volunteers in Medicine Dental Clinic in Wilkes-Barre. We serve Luzerne County only. You have to work or live in Luzerne County. And we do try to serve the underserved. We do have requirements. You have to have a job or be at least looking for a job in order for us to help you out. Our services are completely free once you do qualify, and we have you re-qualify at least once a year. So our mission is to be helping the working poor. And I've been there for 8 years.
Thank you.
Hi everyone, I'm Janine Burkhardt. I'm the dental director at Project Home in Philadelphia, which I've also been at for 8 years. Project Home is a nonprofit organization, and I mainly work out of their Stephen Klein Wellness Center, which is a federally qualified health center. We have a variety of services: medical, dental, behavioral health, nutrition, there's YMCA, a lot of different components. Mainly, we treat patients that are experiencing homelessness or patients that may be at risk of homelessness, so patients that are in the community. And my role, I'm dental director, so that entails treating patients as a clinician and then also some administrative time to kind of work on the operations and quality.
Great, thanks.
Hi everyone, my name is Jessica Brennan, and I work for St. Luke's University Health Network System, Miners Campus, and I am at our hometown health center, primary care and dental. We are in Tamaqua. Micah presented a little bit about our clinic right after lunch about emergencies. We are a rural health center, and we are in a provider shortage area. So our goal is to provide care to our patients regardless of their ability to pay. I am our public health dental hygiene practitioner, and we have a one-chair dental clinic embedded into our primary care office. And I share my room with our part-time dentist.
Great, thanks. Just to level set, I wanted to make sure that we're defining what we mean by safety net providers for today's conversation. So, and maybe this is redundant for the room, but we're talking about providers that are organizing and delivering a significant level of healthcare and other needed services to populations that are uninsured, populations who are covered by Medicaid, and other vulnerable patients. So that would include our federally qualified health centers, our rural health centers, community health centers, and the free clinics, who are often, I just have to say it, like, we're often not included because we're not in federal regulations, but free clinics do provide, we're sort of like the safety net under that federally funded safety net. So I'm really glad to be part of the panel today. Let's start. I'd like to direct this question to Dr. Burkhardt and to Calvin. Can you talk a little bit about how FQHCs use community partnerships to improve patient care or connect with the populations that are underserved by the oral healthcare system in your area?
Sure. So we partner with those in the community, partially through schools and community centers. A lot of FQHCs may have school-based clinics. We don't have that, but we do have some community health workers from the medical side that we've trained that will go out and they help to provide education. Sometimes we'll send out a hygienist who will do a screening and try and refer patients back, so that's been helpful. So a lot of participation in health fairs. We also partner with dental schools. We're fortunate to have students that come from Temple, and that's been really valuable because the students can gain experience in a public health setting, which we hope that hopefully one day will help increase our workforce. We're happy that one student who went through the clinic with us, she's now employed by us, so that's been great. But also for any dentists that then choose to go into a private practice or a DSO, they can still take those lessons kind of back with them to their offices, so that can help to increase some access to our populations elsewhere. We partner with Einstein, their residency program for endodontics, so that helps us to provide some advanced services to our patients. And since they're not with us full time, we can still refer patients to their center, which is nice because they'll treat our patients at a reduced cost, like we would internally. I kind of consider Project Home to be like our own community. So they work on a variety of services, from housing to opportunities to, for employment and education. So just kind of within the community, we integrate. We have a street outreach program. So someone goes out from the medical team specifically trying to meet people where they're at if they're experiencing homelessness and connect with them, whether it's, you know, in a tent somewhere under a bridge. And right now, dental's not going out with them, but if they see something concerning, then they'll refer them back to us and get them a ride to bring them to the clinic, which is really nice. Internally, we also integrate with medical in some of their programs, like medication-assisted treatment. We have dentists that go in and do education there. And we partner with our Centering Parenting and Centering Pregnancy groups. So I know today we talked earlier about really focusing on prevention. So that's where we're trying to target as well. Let's see if we can educate during pregnancy so that we can start a healthy life from the beginning. And while they're not getting direct treatment in those visits, we feel it's still really beneficial because even though in FQHCs we want to treat everybody, there's only so much time in the day and so many patients that you can see, so we try and reach them in other ways.
Calvin, what would you add?
Yeah, I mean, I think it's very similar to what Janine is saying in terms of community organizations. One thing that we have as a faith-based organization, one thing that's a little different is we get a large community of mostly undocumented immigrants from Upper Darby, which is just outside the city, but is actually really quick and easy. The subway train goes right to our door from Upper Darby in about 30 minutes. And so just word of mouth, but we've by having members of our employees, patients, through churches, we connect with people. And, you know, I think, right, FQHCs have a reputation as being low cost is the first thing, as a safety net, provider. But also, I think FQHCs do have, and I think we do as a Spanish-speaking organization, where all of our patient-facing employees all speak Spanish, to the point of even we train all of our dentists that join to speak Spanish. We actually send them to language school. But I think, one thing that we try to do is to be providing, that culturally appropriate care, right? We want to meet people where they are. And so I think that actually draws in, I'm just using this Upper Darby community, that people, there are centers they could go to in Upper Darby or, in Chester County or Delaware County and come up, but they come to us because they know through their churches that, there's, and through word of mouth families, that they can do that. I also just want to say too, I think just to echo, I think one of the challenges is in partnering is, we'd love to be able to open our doors to all, community organizations. I know there was a Prevention Point was one in Kensington specifically for helping people coming in recovery, or even people that are in the midst of addiction that have oral health needs. But we're also right now we are down to just one dentist. In just a couple of weeks, we'll have just one dentist where we had a year ago. And so we want to provide all this care, but like Janine said, we just don't have enough, there's just not enough dentists to treat all the need out there. And so, I would love to have more partnership and that kind of stuff. The capacity really holds it back. But we do what we can within our own health centers to promote oral health.
That is
across all departments.
That is a recurrent theme across all of the free clinics as well. Darcie, could you talk a little bit about what some of the differences are that separate free clinics from other kinds of care in the safety net, aside from financial?
Yes, free clinics we're not federally qualified, so we don't get federal money. So we operate solely on donations, grants, and special events. As of last night at 10:30, I was doing cocktails for a cause, so I'm a little tired today. And all of our services are free. So, and we operate with an efficient but small team of paid staff, numerous volunteers to ensure comprehensive care and provide all wonderful health care to all patients. VIM has volunteer specialties that provide and to not also include chiropractors, physical therapists, dietitians, clinical pharmacists. We do have GYN, and we also have a psychiatric nurse practitioner. They all come in to volunteer their time. The dental clinic does have one paid dentist 1 day a week, but mostly volunteer dentist and hygienist that we use through volunteers. We do also have some great partnerships with endodontists, orthodontists, and oral surgeons that would rather see our patients in their office versus coming to me to help. So that's wonderful. Some do free, some do, half price or whatever they can do. VIM is a community by the community. That being said, we have numerous collaborations that also help with primary care, preventive, and specialty services. I tend to forget the medical side because I'm so dental oriented. I'm so sorry. So I do forget to talk about them, but they are there and they're very helpful. We do get services like mammograms, eye insurance, family planning services, and our lab fees are all free to the patients too. But that comes with having to do all types of crazy things to raise money and begging. I feel like I'm a professional beggar sometimes, but I'm not begging for me, I'm begging for my patients, so it's good.
Thank you. Jess, could you talk, and I'm going to use a little bit of alphabet soup, and I'm going to go back and spell them all out, how clinics can best utilize PhDHPs, RDHs, EFDAs, and dental assistants to run most efficiently. And I did Google these things to make sure I didn't screw them up. That's public health dental hygiene practitioners, registered dental hygienist, expanded function dental assistants, and dental assistants.
Yeah, so there's many challenges when we are dealing with population health, and some of the challenges are low reimbursement rate and having a high no-show rate. So it always poses this question on how do you provide a quality care, practice ethically, operate smoothly, but still book a tight schedule. So I think the key to managing this population is to utilize all of your support staff to the top of their licenses, degrees, and education. So in an ideal clinic, I think you would have your public health dental hygiene practitioners out in your community serving their needs, such as your nursing homes and your schools, such as your child developments and Head Starts, providing prevention, making referrals, giving education, and doing teledental work. Back in your clinic, you could utilize your RDHs, your registered dental hygienist, providing preventative services right in the clinic, and being able to utilize them to give local anesthesia where needed. I think dental assistants could be a great asset to help the hygiene department be more productive in the sense that they can help room the patient, take radiographs, help clean up the room, and do sterilization. I do think FDAs can be, which is an expanded functions dental assistant, they could be a game changer for an office. As we know, dentist procedures are very time consuming. They're procedure based. So if you have an FDA that's able to free the dentist and allow them to see more patients in a day would be ideal. In addition, I think having a great office coordinator to be able to step back and help guide the staff where they could be utilized throughout the day as the schedule changes, and be able to fill in your last minute no-shows or cancellations with any emergencies or any patients that are in need. I think too, to have a community health worker on site would be a great asset. As we know, dealing with this population, there is a lot of management that goes into their needs, whether it's their dental needs, their transportation needs, or needs that go even beyond dental. So having that warm handoff to a community health worker so that they can help be the liaison for that patient. Having a few dentists but many support staff can help lower overhead costs, increase patient access and production, and help with long-term sustainability.
Thank you. Dr. Burkhardt, how can the successes of the federally qualified health centers be used to address stigma among private practice dentists?
Sure. So I think that a lot of times some private practice dentists may think that the work done in public health facilities or FQHCs is subpar. And I don't really know where that idea came from, but I think that the work that we do is awesome, and a lot of times has to be even better because it has to last longer, and we don't know if that patient's ever going to see a provider again. So personally, for me, I'm pretty involved with the Pennsylvania Academy of General Dentistry, and I try and break the stigma a little bit there. We have opportunities we have a master track program, and you can actually go and show some of your cases. So I'll do that, and I'll present photos and what I do. And you know, in the beginning, a lot of people were surprised, like, wow, like, your work looks like my work. I'm like, yeah, like, I may work in an FQHC, but I'm still a qualified trained dentist. So I think just being willing to kind of show people what you do, educate them, can really go a long way. Also, getting involved in organized dentistry in general, I think, is helpful because a lot of people just have no idea what goes on. You can educate them about your patients and kind of the many things that are going on in their lives, and a lot of times you're caring not just for their mouth, but you're caring for them as a whole person, which sometimes may get missed. So I think sometimes that makes us a little bit better as well. But education and getting involved goes a long way.
Thanks. Calvin, how does the clinic setting allow you to connect with your patients and build relationships? Because it sounds like if the word of mouth is spreading, as it sounds like it is for you, that's got to be something you're valuing there.
Yeah, I mean, kind of like Janine actually just said, I mean, on some level, right, the FQHC clinic environment is the same dental environment as any office that's a dental, any dental office out there. And in that regard, right, like, there's a level of vulnerability that comes from every patient, when they're in the chair and they're opening their mouth and someone's looking at them and touching them. And then there's all the anxiety that comes with that, and you have to be open about that. I think where things are a little maybe different in the FQHC, I think, I see as a safety net sort of provider, if you're sort of the provider of last resort, there is not really any other provider that can come in and take over care for this person if it's not an ideal situation, is that you sometimes work in less than ideal conditions. And I don't mean to say like the dentistry is subpar. I'm talking more about things, more of those like social issues. So, I thought about how the numerous mothers who have come in with multiple children and the baby in the stroller is screaming their head off, because we're working on mom, and, our staff sometimes me, sometimes usually our dental assistants step in and they're holding that baby and they're, shushing him and, and playing with them. And, the kids that we have to play with sometimes because, mom's in the chair and we just need 20 more minutes and please, can you do it? And they can't hold still. But they don't have anybody else. There may not be another family member. Or, I've seen it where, people, they had childcare and it falls through last minute, I think for a lot of our patients, their lives are very hectic. And one moment things are stable and the next moment they're not. And I think what that does, though, is, I think, one, right, it opens it up that, they can get the care they need. And I think patients see that. But then I also think that patients feel the sort of like we're not being turned away or we're not, and so in that regard, they're more open to then share, what happened why couldn't you bring childcare? And they say, oh, and then they can go into more detail. I know just, so me being more on the administrative side, so one thing that we do at FQHCs is we have to get proof of income for our uninsured patients. Because we give them a sliding fee discount based on income and household size. And so we have to get that information. And right, like we're not the IRS, so we're not, digging in, tooth and, like just really